Hi, so I'm back with Mental Health FAQs Part 3. I have some new questions today, and then there was a question from last time that I realized I forgot to answer, and that question is, are therapists open on the weekends? Many therapists are open on the weekends and in the evenings. You would just need to give them a call to find out what their hours of operation are. Or if you found them in a directory, then you probably will see the listings there. The next question is one that I've been asked often. What is the difference between a psychiatrist and a psychologist? Also, a similar question is, what is the difference between a therapist and a psychologist? A psychiatrist is a medical doctor, so they go to medical school, and they are trained to diagnose and treat mental health conditions. So they primarily look at mental health conditions from a biological basis or through a medical model of treatment. And most of the psychiatrists, at least the ones that I've worked with, they treat those conditions by prescribing medication. There are some psychiatrists who provide therapy as well, but most of them prescribe medication. They do medication management to see a person's response to that type of treatment and make adjustments accordingly. Psychologists like myself, on the other hand, do not go to medical school, but we go to graduate school, and we have to obtain a doctorate degree in order to be able to obtain a license to be able to practice independently. And we're trained to diagnose and treat mental health conditions as well. Typically, psychologists do not prescribe medication. However, there are 5 states where psychologists can get prescribing privileges, and they would have to actually go through more training in psychopharmacology in order to get those privileges. But most psychologists are not qualified to prescribe medications for mental health conditions. And then in the Department of Defense, there are some psychologists who get specialized training to prescribe medications. Primarily psychologists, particularly clinical psychologists, and some counseling psychologists, they provide therapy. And by therapy, I mean talk therapy, which is the same that I was talking about when I was talking about psychiatrists. I don't think I specified, but talk therapy, meaning they sit across from a person and they help them to problem solve about some of the things that are going on in their lives that are bothersome, right? Another thing that's unique to psychologists is that we, some psychologists actually conduct psychological testing. So we can administer IQ tests, academic tests, personality tests, and that can be done to gain more information about what's going on with the client that we're working with, or for diagnostic clarification for someone else. Every psychologist does not do testing, but that is something that is unique to psychologists. Also, let's see, the other question is the difference between a therapist and a psychologist. So technically, if a psychologist is providing therapy, they're a therapist too, right? But I think this question speaks to master's level therapists. So the distinction between psychologists and therapists who are not psychologists is educational level. Psychologists have doctoral degrees, and which means that they usually go to graduate school and get additional training after college for anywhere from 5 to 7 years. And other master's level therapists, they go to graduate school, but their training is usually a little shorter, about 2 years. So there are clinical social workers who are trained to treat mental health conditions. There are marriage and family therapists who are trained to treat mental health conditions, but their primary focus is working with couples. And then in Georgia, we have licensed professional counselors. And some states, they have therapists with a similar type of training, but they have a different designation, and it's a licensed mental health counselor. But there are also master's level counselors that can treat mental health conditions. The next question is, how many sessions do I need? How long is a therapy session? All right, so I'll answer the how long is a therapy session question first. So that varies, but for me, I treat adults, and usually my first session is anywhere from an hour 15 to about an hour and a half, because I'm collecting a lot of background information. And the sessions after that, the follow-up sessions, are typically 45 to 60 minutes, so average about an hour, okay? How many sessions do I need? That really is determined by a lot of variables. One is the nature of the condition that's being treated, the severity of the condition, the type of treatment that's being used. And so there are a lot of things that would determine how many sessions a person would need. And that's something that you would discuss with the therapist once you go in and meet with them. However, there was an article that was published in 2017 by the American Psychological Association. And that is a national organization that pretty much governs what we as psychologists do. And in that article, based on their data collection and their research, the average amount of sessions that people were in treatment for was anywhere from 15 to 20 sessions. So if you think about going to therapy like once a week, so about 4 sessions a month, so 15 to 20 sessions would be like 4 to 5 months. So that's sort of the average of what they were seeing, that most people, average amount of time that most people were spending in therapy when they were coming in. Now, obviously, there are conditions that require a lot more intensive treatment. If you have co-occurring disorders, meaning that you have more than one condition that's being treated at the same time, you might have a more lengthy treatment. Also, if you have something like a personality disorder or certain types of personality disorder, things that are more chronic might require longer treatment, more intensive treatment, more than once a week, that kind of thing. So that's just to give you sort of a ballpark idea of what typically happens. This is Dr. Melissa Green. I hope this information is helpful. Take care.